PE tubes for? What are we sucking? Wax. Wax, usually. We usually start out with a 5 on a myringotomy, and we rarely go up to a 7. And it depends on the baby too, how little. So these are barren suction tips. There's a 3, 5, and a 7 here.
And they go on what?
The suction. If you notice on the top, there's holes. Same thing for the Frasers. You know the little hole on top? You have to put your finger over the hole to suck. Okay, do not forget that. If you just go like this, you're not gonna suck anything. There's a hole right here on the top. You have to put your finger there, and then it creates that suction.
Wouldn't that be the way you'd hold it normally? Like even if you had the if you had all the tubing on a 2, you'd still.
Not if you have like a 9 Fraser.
Oh.
Which most people would probably hold here because they're longer.
Oh, okay.
But for the barons, yes. Okay, I have bulb syringes, I just didn't grab one. Everybody knows what a bulb syringe is, it's your nose sucker. All right. This is a cautery, it's a Bovie. We use this for TNAs a lot. The good thing about this is it sucks and it coagulates. Okay, so it is a suction Bovie. Suction goes here. All right, and we use these for tonsils. So suction Bovie. This little thing here, do not throw away. The reason is when we are sucking, sometimes the tube gets clogged. This is where this thing comes in. So I'm gonna shake her. Help me out.
2 shaking people shouldn't be doing this job.
So do not throw this away. You can use it to clean out
It's
whatever
like
is
a
there.
stylet on the Fraser.
Exactly.
It's plastic.
The suction on that is constant.
Mm.
Okay, you don't push a button, you don't nothing. I keep thinking you're calling me. All right, herd retractor. This is another tonsil ENT thing. We use this to retract the tonsil right here. This one is really sharp. They're really not that sharp. Okay, herd. So that's ENT. Tenotomies. I have 3 different tenotomies here. This one is very obvious. Stevens has a very distinct, I mean, you can just tell that's a tenotomy, Stevens tenotomy. Then you have smaller ones. Obviously the same thing. This one's not as defined, but then you have some that are like this, that just by looking you can't even tell. You actually have to open it up and you can barely see it. These are Stevens tenotomy scissors. We use these for everything. A lot of plastics, a lot of vascular, a lot of ENT. Okay. Green.
That is really small.
Green we use for thyroids. It's perfect. It goes right on that lobe, and we'll use it to retract thyroids for ENT. Skin hooks, Joseph hooks. These skin hooks are very, very sharp. I cut myself yesterday. Be very careful when you pass these. All right, a lot of times people always stick themselves with gloves. These are sharper than sins to me. Skin hooks, they come in a bunch of different sizes. Sometimes the prongs are right together. I do have some of those. Some of them are smaller, but they're all skin hooks. Okay. Iris scissors. When we do like eye cases, or actually we'll use Castros for those. When we do babies, if we're doing any kind of facial laceration repairs on babies, we don't whip out a big old straight Mayo scissor, right? These are the ones we use. These are Iris scissors.
So they have the same concept as smaller?
And they're a lot more pointier.
They're very straight.
Bulldogs. Bulldogs, these are vascular clamps. We use these, saying this is vessel. We'll use it to occlude instead of actually using a clamp. We'll use these, and there's a bunch of different sizes, okay? They come even smaller, I mean like tiny, and we call those Izzies, but y'all don't need to know that. But these are Bulldogs.
Do they come with the handle sure it has the handles at the bottom of the pencil press.
See how it has like little legs? And these just have little
Yeah, there's these,
squishies.
same thing.
Well, I think like if you don't have that spring in, it'll look like the picture.
Yeah, it's just like this one.
It's just there's a spring in
That's
between.
that picture, that's that one. Okay, next one. Bailey rib approximator, I don't have this. But this is, when we do any kind of or CV cases, obviously if we're doing a thoracotomy and we need to get in the ribs, we open up with that. We also can bring together. This is all heart stuff, okay? Bailey rib approximator, they like this one in CST. This one and the finished shadow.
I couldn't pronounce that. Finish it.
What's the
Michelle.
next one? No, I don't. I wish I had one of those. Castros. These are needle drivers, okay? Castro Viejo has a lot of stuff. We have scissors, we have pickups, we have needle drivers. What is this one again? What's the finishing on this?
It's titanium.
Titanium. And then this is just regular. But we have Castros on there. Those are locking. These are locking, meaning, and remember with these are, God, these, I think they told me about $800. They're not cheap. So when you close them soft. You just don't. Okay? Or you will get yelled at because you'll ruin the spring on this. Same thing when you open. It's very delicate. These don't have any locking. So when it comes to needles, it doesn't lock. So when you, only time you can load this one is when they're ready to use it. You load it and you give it to them. Okay? They're needle drivers.
Why would you use that needle driver as
We use them
opposed
for
to?
vascular, we can use them for kidney transplants, we can use them for a lot of things. When it comes to these, you have to understand, you don't put a regular 2-0 or 3-0 suture. These are more like 5-0s, 6-0s, and 7-0s. Delicate sutures.
Okay.
DeBakey clamps. These are vascular clamps, vessel clamps, whatever you want to call them. But this is a DeBakey clamp. All right, it's just a vascular clamp. We use this for arteries, veins, whatever. It's just a vessel clamp. This is a DeBakey, okay? Oh, Mr. Statinsky, where are you? Statinsky. These come huge. I have some big ones, but this is a Statinsky clamp. The nice thing about this is if we are doing an endarterectomy, the cool thing about this clamp is you still have it exposed and it's occluded on both sides.
Oh.
Okay, so this clamp is pretty cool. This is a Statinsky clamp. Same thing, it's a vessel clamp.
God, that would be great for so many other things.
Yeah.
Instead of using like two I mean, I think like a million other things that would be
Instead of
helpful
using
for.
2 of something, just 1 of that, and it's perfect.
These are all CVPV clamps. Gerald's,
Why does it got that in the middle? I mean, because it's
I don't know.
like it's got that hole. I mean,
Doesn't do anything. Gerald's, we use Gerald's for vascular, peripheral vascular, ENT, plastic surgery. Obviously the tips are really fine, so you know whatever you're doing with suture is gonna be a fine suture. Tissue on this is gonna be a fine tissue. These are Gerald's. These do come with teeth as well. Pot scissors. Pot scissors, we have a whole bunch of different sizes. We even have shorter on the jaws, but these are pot scissors. So what happens is, where's that Statinsky? Let me see that Statinsky real quick, please. So what happens in carotids or endarterectomies, so the whole purpose, if we're doing an endarterectomy, that means there's plaque in a vessel, right? So we'll occlude it, and then what we'll do is we ask for an 11 blade because it's really sharp. We need it to make poke a hole right there, right? And Once we poke that hole, what do you think we're gonna use next? Perfect, because it's the perfect angle.
Oh, that one comes in different angles.
There's
too,
a,
right?
there's a whole, yeah, there's a lot of these that come in different angles, all right, and the different sizes. So think of it that way, it's perfect for a vessel, okay? There you go.
It's just that there's no reason.
There's no reason for it, I don't know what it's for.
Like, I was wondering, like, if he's trying
You
to,
can close it all the way
yeah,
still.
and it just
goes
pokes out
right
through the
the
middle.
I don't know.
Yeah, make me ask.
Well, I was thinking,
Yeah,
yeah,
there's no point
well,
for
I
it.
was wondering, like, if it's like, you've gone too far, cause you can feel it poking your thumb, you know?
No, because they have Geralds that don't have that too.
Oh, okay.
That's
It's
the other
weird.
thing too, is there's Geralds that don't even have that. So it's just the manufacturer. I don't know why he did that.
So they can make it more expensive.
Or just to look different and say, oh, that's my brand. Finishetto, that's a rib spreader. Okay, that's another popular
Is always
CST question.
straight. Yeah.
But you don't have one of those?
So,
I wish, they're
you know,
huge.
like if you're
Yeah, those are way too expensive.
So you use that instead of like having to
crap.
break the
That's
ribs?
to open.
Oh, okay.
Rib rasp. So what these do is they go around the rib and they scrape periosteum. It's kind of sharp on the side. That's all these are for, the doyens. All right,
They're sharp.
Steven Stanley. Doyens, I wish I had a glass one too. But I should have showed these in general, but I didn't want to confuse you because those are really general instruments. This is kind of a special general instrument. The cool thing about doyens is they're atraumatic and they're big. So obviously we can use them easily to go over the bow, right? And we use it to occlude, they don't hurt at all.
I think you did show us.
They're
that.
very atraumatic.